Good afternoon, everybody. Welcome. My name is Haley Yates. I am the Alliance and Carrier Program Manager here at UBA. And on behalf of United Benefit Advisors, I welcome you to today's presentation in the UBA Employee Benefit Webinar Series. Today's webinar, Ready to Take a More Strategic Approach to Employee Wellness, will be presented by Geoff Geredien from Wellable. So with that, Geoff, the floor is yours.
Thank you so much, Haley. Really appreciate it. So excited to be here. As Haley noted, my name is Geoff Geredien. I am the Chief Growth Officer at Wellable. We're an employee wellness rewards and recognition company based in Boston. That's where I'm presenting from today, although we also have offices out in the West Coast and kind of work with groups all over as well as globally. Wellable, this is our first year as a alliance sponsor for UBA. And when Haley, asked me to present today on some of the kind of latest research and trends that we're seeing in the employee well-being area, was thrilled to take her up on that opportunity. And really, that's what, today's presentation is going to be all about. Why employee well-being matters. So we'll certainly address some preconceived notions that are out there about employee wellness, and hopefully whether you're in HR, represent a UBA partner firm or in some other type of benefits role, my goal is just to try to share some recent research about the kind of industry that we operate in, and hopefully a framework that you can act on within your respective organizations. And much of that research that we're actually going to look at today is from a study that was done a few years ago at Oxford University. They have this Wellbeing Research Center, and they partnered up with Indeed. You may have heard of them. A really kind of large database of jobs and companies that post listings to look at over 250 million data points from 25 million different survey participants. So a really substantial data set. And one of the most striking observations from that Oxford and Indeed study was how workplace well-being levels really dropped off, after the pandemic, and that's probably news to no one. But what is interesting is that they really haven't recovered. So, Indeed actually started collecting this data in early 2019. So we have some pre-COVID data, and we know that well-being levels really peaked before that, then dropped sharply, right? And not only haven't bounced back, but like continue to kind of have that decline trend, which is of course concerning. I mean, it makes sense, right, that the pandemic took a toll on employee well-being, not only from physical health concerns, but mental health, financial stress, right? But the fact that that hasn't recovered, and not only that, it's not even kind of trending in the right direction, is something that feel like really merits all of us kind of taking a closer look at. So we have that workplace well-being metric, but then that survey also evaluated basically this concept of whether employees are thriving across four key indicators. So are they happy? Are they satisfied? Do they have purpose in their job? Are they experiencing low stress? And again, amazingly, 22% of employees indicated they are thriving. So that means that more than three-quarters of workers are just not at their best, something that just represents pretty significant opportunity to improve both individual and organizational performance. So what not thriving actually means, again, if we think about those four indicators of workplace well-being, you have happiness, satisfaction, stress, purpose. And employees determined to be thriving at work if they have high ratings across all of these indicators. So by definition, again, those who are not thriving, they're not their highest potential, they're not bringing their best selves to work. And obviously that's not a great experience for them personally, but certainly they're not getting, employers wouldn't be getting the most output and productivity from them. If you look at the numbers here across the board, not great, right? So you have 57% saying that they aren't happy at work most of the time. Another 57% saying that they are not fully satisfied with their job. 59% feel stressed most of the time at work, and nearly half feel that they don't have a clear sense of purpose in their work. And again, not stellar results across the board, but to me, the one that stands out the most is stress being the biggest drag, right? It's the only indicator here where the majority actively report a negative experience of being stressed, not just the absence, of a positive one. And really, I mean, at the end of the day, people can tolerate, a job that they're somewhat lukewarm on, but chronic stress, that's really, what you're going to see push people to disengage, burn out, or eventually, leave an organization. So now hopefully we've established, that workplace well-being is definitely something globally that needs more attention. I think it's important to align on exactly what it is, right? And there's so many different definitions, and like I mentioned before, kind of preconceived notions that everyone might have. But at the most basic level, employee well-being is just how people feel at work. Again, are they happy? Are they satisfied? Are they finding purpose? Are they experiencing relatively low stress levels? And so, well, while that definition may seem, pretty straightforward, the thing that's interesting and so complex and hard to solve for is exactly what we can do to help promote those good outcomes or, why people feel that way. So the drivers you see here on the right-hand side of the screen kind of organize them into these three tiers in like almost like a Maslow, hierarchy of needs kind of style, where you start from the bottom and you have your foundational needs. So competitive compensation, employer trust, flexibility. These are really, your table stakes. And then you have this social tier, this next level up, where you have belonging, inclusion, manager support. It's kind of like the social tissue or social fabric for an organization. And that, of course, is what turns out to matter most to employees. And then lastly, at the top here, you have the growth layer. So that's all about learning, development, achievement, promotion, that sort of thing. And I think the best way to think about these two things is that we're going to measure these outcomes, right? The left-hand side of the screen, and you're going to invest in the drivers to actually help achieve those outcomes. However, there's a pretty substantial gap between the perception of, what matters and what is worth investing in and where investment actually occurs. It's this say do gap, right? So you have 80% or more of senior managers believe that investing in their people is good for business. They get it intuitively. The case has been made, but only 19% actually have it tied to a strategic priority with real action, budget behind it. So you have a pretty large 60 point percentage gap between saying and doing. And unfortunately, I think that's where a lot of organizations are today. They believe in the benefits of investing in people, but without operational commitment, intent, and follow through, it just doesn't really come together. And I think that's where the gap can really get exposed is when you're having these conversations, with your leadership team and you have an initiative in place and your CFO asks, like, what are we actually getting from XYZ, initiative? And if there's no measurement, no KPI, no clear answer, that's where, again, some of the well-intentioned efforts can really kind of, come into question. And the thing I want to make abundantly clear is that I don't think closing the gap here should require a bigger budget. It really is just about treating well-being the way that employers would treat any other strategic priority. It has to be measured, owned, actually tied to outcomes. And that's what I want to focus on today is understanding a little bit more about why this gap exists, what the research says, can actually move the needle, and hopefully give you all, a little bit of a framework that you can use to kind of, self-evaluate where your organization stands today. So we just established, that gap, that say do gap that, exists. Now the question is, how can we actually help you build out a business case in the way that can close that gap and, proving the value of these, different initiatives and actually getting some operational support for it. So the research really points to three key places where value for workplace well-being is the strongest and most defensible. Productivity, retention, and recruitment. So very simply, productivity, happier workers are going to produce more. Retention, high well-being workplaces are going to see less voluntary turnover. In recruitment, the best workplaces out there are going to attract better talent, and that, of course, is really going to compound over time. Now, the traditional way that this industry, in health and well-being, tends to try to prove ROI is through reduced healthcare costs. And I think that's actually the wrong question to be asking or the wrong way to go about it. Claims data can be very noisy. It can lag by years. It's dominated by, a couple high cost outliers. So in any given year, you could have, a cancer diagnosis or some other kind of unique event that swings your ROI study, substantially, and really doesn't tell you a lot about whether the program, is working or not. So I think what we're seeing is more forward-thinking employers are trying to move past that, legacy lens of the success or ROI of well-being programs, because those metrics on productivity, retention, recruitment can just deliver value in a much higher order of magnitude and are, again, easier to defend, as we'll get into here shortly. So this is something, if you take away, one thing, one slide or one, image for your team, this one I think is just really, really cool. So Indeed actually publishes something called the Work Wellbeing 100, and it's a list of the top 100 US public companies ranked by their employee survey scores across happiness, satisfaction, purpose, stress, right? Those work well-being indicators. Many names Delta, Nike, Accenture, H&R Block, Disney, IBM, right? So not like, kind of fringe companies, but truly mainstream household brands that have just invested, quite a bit and quite efficiently in workplace wellness programs. 5 years running, as you can see from this chart here, the Workplace Wellbeing 100 has beat the S&P, the NASDAQ, the Russell 3000, every benchmark every year. So if you had invested $1,000 in the Wellbeing 100 back in January 2021, you'd have $1,533 by July of 2024. That same $1,000, you put that in S&P, you'd have a lower return. Then there's that 5% outperformance gap between the Workplace 100, Workplace Wellbeing 100, and the S&P. Unfortunately, not an investable index quite yet. You can't go and Robinhood and buy this ETF or anything, but the signal is what matters, right? Like, if anyone's questioning a well-being investment, whether it's worthwhile, the market itself is telling you that it will pay off. So now that we kind of have that in place, I think we can look at the three pathways where well-being actually translates into company performance, right? So again, we'll come back to these a lot: productivity, retention, and recruitment. So on the productivity side, we know again that happier workers are going to produce more. And there's a study that we'll look at in a second from, again, Oxford and BT, where they did an analysis of a call center to really establish that causal relationship between happiness and productivity. On the retention front, we know that high well-being workplaces see approximately 1/3 fewer voluntary leavers than poor ones. So that's, again, a hard dollar number that any CFO can model against when you're looking at the impact of retention. And then lastly, on recruitment, we'll look at some of it today, but there's more public data than ever on what it's like to actually work somewhere. You have Indeed, look at this, Workplace Wellbeing 100. You have LinkedIn reviews. You have Glassdoor, employers with strong reputations that are recognized by actual employees as great places to work are going to attract better talent. First, they're going to do it faster at a lower cost per hire. And again, all of that just compounds, over time. So I would think of these three pathways as the foundation of the business case as you think about how to socialize this internally. So looking at that element of productivity, the study I mentioned was actually with the Oxford Wellbeing Center and British Telecom. So they're a telecommunications company based in the UK. They looked at 1,800 call center workers across 11 different locations, and they tracked this weekly over a period of 6 months. And they basically made the connection between each worker's self-reported happiness to administrative data on the number of calls they made, how many times did those calls convert to actual sales. And the clever part of what they did is they used local weather as kind of like a random shock to each employee's mood. So days where it was rainy, foggy, or gloomy, outside of the windows of the call center, they would connect that to, as you can see here on the left chart, the density of those self-reported happiness on poor weather weeks. So you can see here at the highest bar, there's just a much higher density of employees reporting that they were very unhappy on those poor weather weeks. And then if you look at the right-hand chart, similar concept, except it's measuring sales. So on those poor weather days, you had much lower output in terms of sales on the days when they were gloomier. And the headline finding is that a 1 point increase in happiness on a 0 to 10 scale drove 13% greater productivity. And workers aren't working more hours during that time. They're not doing anything different. They're just more effective at what they do. So we obviously can't manufacture sunny days. We can't build weather machines and stuff like that. But the concept is that if you can build conditions that create happier workers, that's where that well-being investment will absolutely have an impact on output. Okay, so that's the productivity side of things. Now we think about retention. So the big stat here on the screen, right? 1/3 fewer voluntary leavers in high well-being workplaces. That stat comes from the same Oxford study, which basically compares employees at top quartile well-being workplaces against bottom quartile workplaces. So in that Indeed data set. And it's specifically unwanted turnover. So the people that you actually want to keep are walking out the door. And so the math again is pretty simple. This type of retention, savings exercise is definitely a common one that any CFO would certainly be familiar with. But you're using these assumptions based on kind of vetted independent research that you assume 1,000-person company average salary of 60,000 per year. 25% turnover. They're spending over 10 million per year on replacement costs. If you're using SHRM's, standard 75% of salary benchmark to replace. And if you just reduce that number by 1/3, you're locking in, close to 4 million per year in savings annually. So, this is one slide where we definitely can see CFOs and others kind of looking after, employee kind of benefit operations and budgets kind of lean in a bit because that retention number is just the easiest way to model cost savings, given that replacement cost is a line item that should be probably already well established in your organization. And what I think is interesting too is that this is really something that tracks both from a academic standpoint, this kind of research that's been done with what we see Wellable at our own book of business. We have engagement data on every Wellable user and can see when people leave companies through eligibility file feeds. So we run the same type of analysis at the client level, and the results are consistent. Those who are engaged with our well-being program consistently stay longer. They leave at a lower clip, than non-engaged employees at the same company. And then lastly here, we think about recruiting and how you can use a really high performing well-being score to your advantage. So what I'm showing here, this is Delta's actual public company page on Indeed. As you can see here now that these well-being scores are actually displayed alongside salaries, employee reviews, job listings. They're visible to every job seeker before they even apply. So Delta is one of those, workplace well-being top 100 companies. So they're scoring quite high, 81 out of 100. Indeed breaks it down into these 4 core indicators that we've been talking about. So you have happiness, satisfaction, purpose, stress levels. And then you can actually go deeper and look at the underlying drivers. So for achievement, learning, belonging, support, they're all individually rated, and you can click in to learn more. But based on the, almost 3,000 Delta employee responses, it's not like a marketing claim, right? It is actual employee data that has a clear methodology behind it, and employees can really, prospective employees, prospective candidates can really have trust in. And the point again here is that well-being has never been more visible, right? This might be in the past something that you would just hear through word of mouth, or again, maybe you ask questions about it during the interview process, but it's just becoming so much more evident. And for those employers that have a strong well-being story, like Delta and others, this is a real recruiting asset. But for those with a weak story, it can be kind of a tax and a hurdle that you have to navigate. So now that we've covered the business case, right? Productivity, retention, recruitment, you've got stock market returns. Like to think the evidence is in and hopefully pretty strong. I think that should answer the why bother question, but it doesn't necessarily tell you what to actually do. So I think it'll be good to kind of check out what to invest in, which drivers actually move the needle on well-being, which don't. And this is where a lot of companies and vendors, to be fair, can misfire. We're, putting budget into the wrong drivers, wondering why things aren't working. And the data here is actually, somewhat counterintuitive. What a lot of leaders assume matters, just the reality is often isn't exactly what the research shows in terms of, what drives well-being. And that can be where, some strategies can kind of get off the rails. So what we're showing here, this is Oxford's regression analysis that basically ranks all 11 drivers by how much each one actually impacts and influences well-being. So the chart on the left here, basically a bigger bar means more influence on how people feel at work. So the top three here are all social drivers: belonging, energized, inclusion. And you can see they really kind of dominate, all the other options. Compensation and flexibility actually sit near the bottom here, and they're again outweighed by those social drivers by 4 or 5 times. And thinking back to, well, why is that? It's probably again not what you'd expect. Compensation you'd think be at the top. Reminder to kind of think back to that hierarchy framework that we looked at earlier, where you have the foundational layer: compensation, trust, flexibility. Those are foundational needs. They're table stakes. They're not true differentiators. Of course, you have to get them right, but like that's not going to drive long-term well-being. Compensation in particular, has diminishing returns. Once people are paid fairly, more money is not always going to translate into more well-being. You can't really outpay, a culture program. And in, focus groups, what the study actually showed is that people would literally say, I just want to feel like this place cares about me as a person, as something that is really most important to them. And that's belonging, right? That's the single biggest lever that any organization has. If you look at the chart on the right, I just thought it was interesting. It's not like a US or Western finding necessarily. I mean, you can see those top three drivers showing up across the US, UK, Germany, India, right? Magnitudes obviously vary a bit by country, but that hierarchy is really universal. If you go in one layer deeper, right, there's like this old HR saying people, don't quit jobs, they leave bosses. And again, the data here definitely reinforces that with, I guess, one small update being that it's not just the boss, it's the whole team and really the, immediate work environment. So you can see, these survey questions in the slide, what makes you feel a sense of belonging, what makes you feel included and energized. Those are the top three drivers that we just looked at. You can see, notice the number one answer, for belonging here in the upper left: feeling like my company cares about me as a person, 55%. That's the same language that came up in the focus groups. It's all about, being treated as a human, not a resource, right? And then you can see in the belonging column as well underneath, things like friends at work, understanding how you impact other teams, value alignment, casual conversations, being invited to, meetings. Almost all of it flows through managers and immediate teams, and certainly work arrangements, which I'll talk about in a second. But the universal finding here, right, is that there is just really an outsized effect on individual well-being, engagement, mental health, based on, your manager and your immediate team. And yet, if you go back to that say-do gap from earlier, right, most organizations are probably, still underinvesting in manager training. Say managers matter, but really have to, fund that part of the development to make sure that they're equipped to help folks with their well-being. So one other kind of concept here that I thought was interesting is around this element of, hybrid work, right? And the reality is that in this kind of post-pandemic world, hybrid is, of course, the dominant model for most knowledge work. I think there's different, variations of how companies set this up, but probably room for improvement in how it can be structured. I think we probably know what doesn't work very well. Fully remote is difficult to maintain some of those kind of social and intellectual, capital pieces over time. And then fully in office, you're kind of throwing away some of that flexibility that at this point, certainly no one wants to give up. But the research really does seem to converge on maybe 3 days a week in office as being the sweet spot. I think a lot of companies have moved in that direction. So kind of a true hybrid model, but without coordination, that's where you can almost have the worst of both worlds because those days have to align so that you're actually seeing your immediate team, seeing your manager. If half your team is in Monday, Wednesday, the other half Wednesday, Friday, or everybody just gets to pick their own days, you've kind of eliminated the point of being in the office, and you're still paying that commuter tax, literally both in dollars spent and obviously in time as well. And I think the overlooked thing here is tasks have to match the days whenever possible. There's not, you can't always stick to this perfectly, but there's no point commuting in if you're just kind of, doing independent work all day or on Zoom calls. We at Wellable have anchor days on Wednesdays and Thursdays. So that's when everybody's in. We try to do as much collaborative work as possible. So anytime we can take client meetings together or, have our group meetings or, really focus on mentoring and one-on-ones during that time, those small structural, choices have been really big for us to make sure that, time is used as meaningfully as possible. All right, so to kind of wrap up, and this is the part where I know, webinars can definitely fall apart a little bit because everybody's nodding along or nodding off, hopefully not. But what do you actually do tomorrow, right? Other than get ready for a nice long weekend. I think we've covered why well-being matters, what actually drives it. So now the question is, how do you actually move from saying to doing without needing a bigger budget? I thought it'd be helpful just to establish a few questions that I've seen work well for, again, anyone who's trying to self-evaluate where their organization is today. It's not like a maturity model or a scorecard. Those certainly exist out there if that's the direction you want to take, but just five very simple questions that should work for any size company, any industry. So this first question here, again, most organizations have probably a lot of metrics around employee well-being, but rarely have a single number or just like a few key numbers that they really trying to hone in on. So trying to get one or several key metrics through a quarterly pulse survey. Indeed, and Oxford actually have this 4-question composite. That's an open methodology that's available. You can replicate that. Gallup has their Q12 engagement survey. There's ENPS, or even just very simple, how do you feel about working here on a 1 to 10 scale? You could, assess that monthly. I think the format matters less here than just kind of picking one and being consistent about it. The second question, not every organization is in that Indeed study, obviously, but you can certainly build your own, driver analysis through engagement surveys, employee listening posts, focus groups, open-ended exit, or even better, stay interviews that are kind of coded for specific themes. Question three, so retention, right? This is, as I mentioned earlier, where the dollars get real. And we run this analysis with our clients, comparing turnover between wellness program participants and non-participants, but there's certainly other lenses. So you could run this by tenure, by manager, by department. The point is kind of knowing, what your disengagement is actually costing you. This fourth question, just kind of taking, honest stock of what's currently being funded for your well-being initiatives. If every line item is all about individual support, so, wellness apps, EAPs, lunch and learns, and there's nothing that addresses workload, manager capability, culture, that there's obviously some imbalance there. And then lastly, one of the easiest wins on this list, Most, insurance carriers these days are offering some type of wellness funds or credits or dollars. They come by various names, but effectively it's a stipend that employers can use to pay for a variety of different well-being initiatives. I heard from one insurance rep recently that upwards of three-quarters of these funds go unspent every year, which is just free wellness budget sitting on the table. So definitely encourage you check with your broker, check with your health plan, to see what's available. I thought it would be important to double click on that kind of individual versus organizational well-being initiatives. And it's not to, do one versus the other. It's really both of these are required to, again, actually enact change any company. Individual programs are critical, right? Wellable is an individual, program largely. So mental health resources, lifestyle benefits, holistic wellness platforms, skill building, that gives people actual tangible support they can use day to day. And they're often, a big part of what makes wellness strategies feel real to employees, tangible. But those individual programs can only go so far. You can't fix structural problems like unsustainable workload or managers who aren't, equipped the way they should be. If the culture is off, there's no magic app or program that's going to compensate for that. But really, the reverse can also be true, is like trying to get a culture on the right track without giving people things that are tangible to use. Just, they're not going to feel supported in those moments when they need, help or resources. So I think a good exercise here is kind of pulling up your wellness budget and splitting it into these two different halves. The supports the person on one side versus, fixes the environment, the organization on the other. And most companies might come out like a little unbalanced in one direction or the other. And that's usually, where there's, maybe some opportunity to do some rebalancing. And I think the five questions from the previous slide would probably be a good way to figure out where you're strong and where you maybe are a little thin. It's not to say, hey, we have to invest net more dollars into well-being. It's just making sure that those dollars are being invested thoughtfully and both kind of sides of the equation are funded and working together. And then one, last kind of slide here before we wrap up for Q&A, just a kind of quick look about how we here at Wellable think, you can create highly effective well-being programs. I mean, again, the research tells us, well-being strategy equals proper measurement, drivers, and structure all combined. So I think any good partner has to do all three. And we are definitely very focused on helping companies measure outcomes, right? Not just the inputs, really distilling that noise into a small number of KPIs that actually matter, both quantitative and qualitative, instead of a bunch of disconnected data points that are tough to act on. Social by default, really deliberately building experiences around that concept of socialization. So holistic wellness challenges, employee recognition, anything that's going to support belonging, energy and inclusion. And then lastly, backing the manager, whether it's content, challenges, education, tools that are just easy to understand. So at any level, you can communicate those, use them with your teams, and becoming instead of just becoming, another thing on your plate. So with that, I'd love to, kind of wrap up and give the remaining time to any questions that have come through. Looks like Haley, you came back off mute, so maybe let you share if there's anything in the chat.
Yeah, just a reminder too. I know it takes an extra minute or couple seconds to physically type a question, so I'll leave this Q&A open, but that Q&A box should be down below on your banner there. We do have one question that came through. Do you have a platform where we as a broker can manage different well-being programs for multiple clients?
Yep, that's certainly, an approach that a number of broker partners take. I think because it's one way that, you can provide value to your clients in a similar fashion and kind of have a central view over, a portfolio of groups and kind of, manage wellness, programming on behalf of.
Awesome. We did get another one here. What are some examples of holistic wellness challenges your team encourages?
Yeah, it's a great question. I mean, the most classic example of wellness challenges are, probably conjure up ideas of like step challenges or some type of physical fitness challenges, and those are great, right? There's nothing wrong at all with a good old-fashioned fitness or activity challenge. It's popular for a reason, but I do think that where we see just experiences that check some of those boxes of being inclusive, creating a sense of belonging. It's those where you can engage regardless of your fitness level or your interests. So, challenges that encourage folks to learn more about like the science of happiness, right? Or practice acts of gratitude, or even things like plan a new vacation as part of the kind of that gamified experience. And then also just trying to lean into kind of fun events that are going on at any given time. Like this year, we have the World Cup, right? So a lot of our clients are running like the Summer of Soccer Challenge, where you have the ability to learn about, team trivia or learn about World Cup trivia and things like that, and have kind of like a, country by country, challenge.
Geoff, I guess I have a question of my own off of that. Are your challenges, are they customizable? I mean, this one with
Mhm.
the World Cup seems pretty unique to what's going on currently. So is that
Mhm.
quality as well for each client or with certain broker groups?
Yeah, absolutely. I think that's probably one of the most, popular features of the Wellable offering is, certainly that you can adapt it and make it feel like a initiative that is very tailored to that company. So, I mean, there's some basic things you can do, right, with like putting in kind of some of the company branding and messaging, but I think also. And this is something that I just saw come through the chat from Timothy. Capitalizing on existing social events is a perfect way to do that. So, promoting those and saying, hey, if you attend the kickball tournament or this blood drive, you can get extra points towards the challenge. So I think it's something where it allows you to up level other initiatives and also get more, engagement in that, kind of specific well-being challenge initiative.
Amazing. Thanks for typing that in, Timothy. That was a great opportunity. And I feel like
Yeah.
it pulls in the community aspect as well, being able to do something local for people if they're all in the same area, or getting people more involved as well is awesome.
Exactly. And I think we've even seen groups who, really lean into that community element where, rather than, again, a traditional wellness challenge reward could be like gift cards or something like that. You could pick a local charity to donate to if your team or your group as a whole, reaches a certain threshold. And that can just kind of make the whole thing feel really good.
Another one just popped in here. Is your pricing based on various levels or company count or possibly both?
Yeah, I think this, HR benefits industry is an interesting one, right? Because so many solutions are priced truly on per employee per month, right? So like the most common, way to price any sort of product. What we do for most of our solutions is we try to price on a per user or per event basis, just to make it, again, as cost efficient as possible. And that kind of goes back to this whole idea of trying to get more out of your well-being investments and balance the money that you spend on software with, all the other things you're trying to do around, manager training and, bigger picture organizational efforts. So, if you can make it really cost efficient and only pay for those who are using a platform, or just say like, hey, we want to run like one challenge this year and have an option that's very targeted and time bound. I think that can go a long way when you're working with your broader management team to set, budgets for employee wellness initiatives, and that's definitely something that we, try to embody with our pricing model at Wellable.
Awesome. Don't think I see any other questions coming in now, but Jeff's contact information is here on this slide, and then everybody who RSVP'd and is in attendance today will get access to a link to the recording of this if you want to check it out again or want to review anything that Jeff was able to share with us today. So I'm going to thank you, Jeff, for your thought leadership and sharing your expertise with everyone today, and also thank all of our partner firm employees and any other clients who might have joined us today. Our next webinar, which is Ready for a Modern Playbook and Self-Funded Health Plans, will be on June 16th, and we hope to see you all there. So thank you again for everybody attending today, our UBA Employee Benefit Webinar Series. Have a wonderful afternoon, everyone.
Thanks, Haley. Thanks, everyone.